to invite Anoop. Sorry, I've got a list of hungry. And Anoop is going to be speaking to us about the hardship that deaf people face and accessing healthcare. So I hope you will.
Listen. No. Really listen. Silence can be deafening. Imagine that you've never heard the softness of your mother's words, the music of Mozart, the cries of innocent excitement in a school playground. Welcome to the world of the deaf. Hearing is something that I've always taken for granted. Like you, sound has been an essential, although often unconscious part of my life. Recently, I had the pleasure of meeting somebody who had been born deaf. You couldn't tell, John looks like you and I. Similar to other forms of invisible disability, there are no visual clues to deafness. No crutches, wheelchairs or guide dogs to even give you a suggestion. It was only when I first spoke to him, and he didn't respond, that I realised something was not quite as it should be, and I would have to communicate in a different way. Following that first clumsy encounter, I have come to know John well, and he has taught me to communicate in silence, just using my hands. I'd never heard of British Sign Language until last summer, but now I've seen another world, and more importantly, brings me to my subject today. Just how hard it is to navigate healthcare if you cannot hear those trying to help you. Please listen again. There are over 50,000 deaf children in the UK. There are over 12 million people with hearing difficulties in the United Kingdom. But there are only 150,000 people who use British Sign Language in these isles. You can see from these statistics that British Sign Language is underused and mostly unknown outside the deaf community. Do you know what I'm trying to tell you? I'm trying to tell you that I think I sprained my ankle after falling over. What was your first reaction to my frantic waving? Did you think I was drunk? Was I being attacked by a swarm of bees? You are all trained first aiders, but could you help me? That was perhaps a little light-hearted, but imagine you were deaf and have just been knocked over by a speeding car at a busy junction. Perhaps you just hadn't heard it approaching. Fortunately, an ambulance crew arrived quickly. What's happened, they ask, as you roll in the road in agony. Because you are deaf, you've never heard the spoken word. You don't know what language sounds like. And when you try to reply, your speech sounds strange and often slurred. It can make you sound drunk as you try to speak. So, when you answer, the crew are unsure where you've been injured or if you're under the influence of alcohol. You arrive at A&E and triage recognises that you were deaf, but because it is a busy Friday night, it takes hours to arrange a signing interpreter. You cannot explain how the accident happened or just how much you hurt until the interpreter arrives. This inevitable but unnecessary delay only increases treatment times and is incredibly stressful for patient and nursing staff alike. And the difficulties in trying to coordinate consultants, nursing staff, X-ray technicians and a signing interpreter is in a busy A&E, all simply because the patient cannot hear what is being said. I hope this little snapshot illustrates just how difficult life can be for the deaf, particularly when their lives depend on us, the hearing majority, to provide prompt and effective healthcare. There is not only the human cost of delaying treatment, but in a cash-strapped NHS, paying over £200 for an interpreter to attend a patient. The total expenditure can be huge. Now, this is why I'm here today. I urge you to all learn British Sign Language and encourage every healthcare professional to take deaf awareness training. It will help us all to save lives and money. Another factor I'd like you to consider, most 5-year-olds are taught French in schools. If I say bonjour, you all understand my greeting, yet there are certainly more deaf people in the UK than French nationals. It's a bit ironic, isn't it? Even as children, we should be made aware of the silent majority and help make their needs understood. As John Kennedy said when President of the United States, think not what your community can do for you, but what you can do for your community. As a final consideration, I am moved by the words of Martin Luther King. If you talk to a man in a language he understands, it goes to his head. If you speak to him in his own language, it goes to his heart.